I am Dr. Hitendra K Garg, working as a senior consultant in gastroenterology and hepatology in Apollo hospitals. Today we will speak on the cirrhosis of liver. So what are the causes of the cirrhosis? How do we recognize them? What are the symptoms of the cirrhosis? If one patient has the symptoms of cirrhosis, then what are the symptoms and how do we evaluate with these symptoms? What are the investigations of the to evaluate the cirrhosis of a liver, and what are the treatment options? Cirrhosis of a liver is being defined as the chronic irreversible liver tissue damage where the healthy liver tissue is replaced by the scar and the fibrotic tissue. In our country, cirrhosis of a liver, there are certain environmental factors, certain genetic factors. If we look at the genetic factors, there are some gene deficiencies, there are mutations, and if we look at the environmental factors, most common in our country is the alcoholic liver disease. Second one is the hepatitis B and hepatitis C. This India is considered to be endemic zone for hepatitis B and hepatitis C. And third one is which we most commonly see in these days is the NASH related liver disease. Treatment options. It depends on the liver disease. The liver disease, as I said already, there is a most common cause of liver disease of liver cirrhosis in India is the alcoholic liver disease. So if we stop alcohol, then we can prevent the alcoholic liver disease. But once it develops the cirrhosis, you can't, even if you stop the alcohol, you can't prevent it is already happened. So you can't prevent the cirrhosis. But even if you stop the alcohol, it prevents the further decompensation. Decompensation means patient develop ascites, patient is having a jaundice, patient is pleural effusion, patient can develop altered sensorium, patient can prevent the development of a liver tumor. So if we stop the alcohol, definitely we further prevent the decompensation. But once it happens, the cirrhosis, you can't. Secondly, if we talk about the second most common cause is the viral hepatitis. In our country, the most common cause of viral hepatitis is the hepatitis B, followed by the hepatitis C. The hepatitis B, once a patient develops the cirrhosis, definitely you can't prevent it to reverse it, but definitely you can prevent the development of this decompensation. There are certain, if we talk about the treatment against the hepatitis B, there are antivirals which very effective, which we start, and it has to continue for almost lifelong, so we can prevent the decompensation. By and large, the cirrhosis of a liver is divided into two parts, the compensated and the decompensated. The compensated means there is a cirrhosis but there are no symptoms. Mostly in these group of patients is usually asymptomatic. 60-70% they are asymptomatic. In these group of patients, the most common symptoms is the fatigue, the weight loss, and once it develops a decompensated cirrhosis. Decompensation means development of a jaundice, development of a coagulopathy, development of a hepatic encephalopathy, patient develop a tumor, patient may develop a ascites, patient develop a effusion. The most common, usually I told the symptoms. If the symptoms in the compensated cirrhosis, usually they don't have a symptoms. The most common symptoms, as I told, is the weight loss, patient is malnutrited, or patient has decreased weight. Apart from these, usually they don't have a symptoms. So in these cases, how do we evaluate? We just do the routine blood test. Routine blood test means we do the blood test, CBC. You can look at the TLC level. You may find the low TLC level, you can find the low platelet level. You do the next test, you do the liver function test. You might see some increase in the bilirubin level. You can see there is a decrease in the albumin level, some alteration in the SGOT and SGPT level. Another test, we do the PTINR. In some patients there you can find the increase in the PTINR level. If these tests are normal, you can move forward, you can do the ultrasound level. Ultrasound, you can see there is a alteration in the ecotexture of a liver, you can see the ascites, you can see there is a collaterals, you can see the increase in the portal vein. And another test is the endoscopy, you can find the varices. And later the last, the most important test is the CT scan of the liver. Today we have discussed about the cirrhosis. What are the causes of the cirrhosis? What are the common symptoms of the cirrhosis? How do we detect, how do we diagnose the cirrhosis? And if we have a symptoms related to cirrhosis, or patients having a symptoms somewhat related to cirrhosis, then how do we treat them? How do we treat alcohol? How we treat the viral diseases? And how do we prevent the NASH related cirrhosis? If we have these symptoms related to liver disease, please do consult nearby liver doctor. Stay safe, stay healthy, stay informed. Namaste.